Hello everyone, my name is Beth and welcome back to NF Talks. And today's episode I'll be talking about staying sun safe, especially when you have certain medications, and obviously because we live in the UK and we've had quite bad heat waves recently, something which we're not used to. I'll be also talking about gastroparesis, psoriasis and eye examinations. I have everything on here because this helps me keep everything in check, and I've written everything down as best as I can. So I want to start off by saying that just because we have NF1 does not mean that our skin burns easily. I have sensitive skin, so I can burn more easily. However, constant skin exposure can make our cafe spots appear darker than normal, which might startle us and give us a little bit of anxiety, but it is completely normal for them just to darken over time and in sun, and then obviously when we come in. Now, just because we do not burn easily does not mean we still have to keep sun safe like everybody else. So obviously lather up on sunscreen if you can, something that is above factor 50, and stay protected in shaded areas. Now, having said that, even though having NF1 does not mean we are prone to burning easily, we are, however, at a higher risk of developing certain skin cancers, and research, especially recent research, has shown that people with NF1 have double the risk of developing skin cancers such as melanoma, which is around 127% increase in the general population. And studies have also suggested that when melanoma occurs in someone with NF1, it tends to be diagnosed as someone who is younger, but it can progress and get more aggressive. So there are some common skin cancers like basal cell and squamous cell carcinoma, which the risk for these non-melanoma skin cancers, which are often called keratinocyte carcinomas, is about 30% higher in people with NF1. And obviously with us having NF1, we do not have neurofibromatosis, which helps us not develop tumours. But without this neurofibromatosis, when it's not working properly, it does trigger hyperactive cellular pathway, the RAS pathway, that can allow abnormal skin cells to grow more easily, which makes us prone to skin cancers. Now, the different things that we have to be aware of, and just to keep in check, make sure our skin is okay, is what's known as the camouflage effect. So people with NF1, we have a high density of flat capillary spots, freckling and raised benign cutaneous neurofibromas. This makes it incredibly easy for a dangerous new mole or new patch to hide in plain sight, which is known as camouflage, like a wolf in sheep's clothing type of thing. And it's also known as the ugly duckling rule, and it's called that because it's part of the research. So to make sure to look out for the ugly duckling, a spot that looks completely different, darker or more irregular than any of your other birthmarks or other capillary spots or any other patches you have on your skin. And there are what is known as the ABCDs, and there is an NF1 twist to it as well. So asymmetry, one half doesn't match the other, so one part of your capillary spot doesn't match another capillary spot. It's best to check it out. Border, any ragged, notched or blurred edges, again, make sure you get it checked out. Colour, uneven shades of black, brown, pink or red. Now, we know with the capillary spots, they are little brown patches there. And it's just make sure that they are sort of all the same colour if we can. And if they are a different colour, again, note it down, and if you worry, get checked out. D is diameter, which is larger than 6 millimeters, though some melanomas can be smaller. And then E, evolving, which is the most critical factor, which is changing size, shape or colour. So our normal cafe au lait spots are, can you see there, are that colour, and if we get anything that's different to what we're used to, note it down, keep an eye on it, but if we are worried, we can always ring up our specialists. Then obviously with cutaneous neurofibromas, obviously these are the soft surface level skin bumps and are completely benign, and they do not turn into skin cancer. So that is reassuring to those of you who have cutaneous. Now with plexiforms, that some skin surface bumps are safe. Deeper plexiform neurofibromas do require medical monitoring because they do develop into MPNSTs, which is why we have to make sure we are okay. I've just skipped ahead a bit there. When to flag a bump if you are worried it is skin cancer. If you spot a new spot or bump, whether it's flat or raised, and it suddenly starts bleeding, starts raw, cross over, or grows rapidly, or causes persistent new pain, it needs evaluating immediately. Now sometimes they can bleed out of nowhere, but it's always just get it checked out, even if it's at your GP, just to make sure you're okay. Now again, with this being sun safe, there are medications which we have to be wary of when we're out and about, for those of us who do take medication. Now, I am not a pharmacist and I'm not obviously a doctor, so just take this with a pinch of salt and just be wary. So there are various medications which you have to be very, very careful of, such as antibiotics like doxycycline, tetracycline, trimethoprim, all of those types of antibiotics, pain relievers and anti-inflammatories or NSAIDs like ibuprofen, naproxen, water pills we have to be careful of in the sun, antidepressants, especially with the likes of amitriptyline, acne treatments we have to be careful of again, because taking these medications can also affect, obviously with sun exposure. There's also heart and blood medications, antifungals and diabetes medications. So if you are taking any of these medications together, or if you've just taken one, it is always best to practice comprehensive sun protection to prevent skin reactions, because it can make our skin more itchy than normal. So what to do, obviously in the sun to make sure you are safe, is use an SPF 50 or above daily, and reapply it every 2 hours if you're outdoors. Obviously cover up if you do get itchiness with the sun. Make sure you do cover up. So tightly woven clothing is usually best, and wide brimmed hats, and UV blocking sunglasses. Physical barriers like a UV blocking umbrella is also a good option, because they're excellent at preventing light from hitting your skin directly. And I know sometimes we get hot and itchier when we are covered, but I find that covering myself is a lot easier for my skin, because I do itch in the skin and I get red raw. So avoiding peak hours, which is between 11 and 3 p.m. that is sometimes can be very, very difficult. So try to stay in shade or indoors when the sun is the strongest, which is obviously between 11 and 3. Stay hydrated, that's the big one, because many of us do not get that thirst, especially if we're autistic. So stay as hydrated as you can. Avoid things like fizzy pop, because sometimes fizzy pop can cause you to be even more dehydrated, which causes more things. So water or flavoured water. And do not, this is a big one, do not stop taking your medications, especially if you're do develop an unexpected rash or burn, do not stop taking them, because without speaking to your doctor or your specialist first, because stopping medications abruptly, like such as the amitriptyline, gabapentin, bisoprolol, can affect and cause severe withdrawal or heart issues. So please take that with a pinch of salt, because I am not a medical expert. I am just relaying what I have researched. So that is about saying unsafe. Now we are going on to the next one, which is gastroparesis, which people with NF1 do have a higher rate of developing. So gastroparesis is a chronic medical condition where the stomach cannot empty itself of food in a normal fashion. So it is caused by damage or dysfunction to the nerves that control the stomach muscles, preventing them from contracting properly to push food down to the small intestine. The results in standard symptoms obviously are chronic nausea and vomiting, feeling full very quickly after starting a meal, basically after a mouthful or two, severe abdominal bloating and upper stomach pain, and acid reflux such as GERD. Now these are symptoms I've had for over 400 days, and people have obviously pushed past it for these 400 days. Because as you know, my previous podcast was a bit late because I was in hospital for 400 days of nausea, which resulted in me not being able to eat for a week. 4 months, sorry, not a week. I've been eating consistently for a week now, which is good. So I put on 1 pound, which is really, really good. I'm getting better. So just keep on top of that. So why are people with NF1 more likely to develop gastroparesis? So because NF1 is fundamentally a condition that disrupts how nerve tissue grows and functions, it can directly compromise the enteric nervous system, known as the ENS, which is the massive web of nerves that line the entire digestive tract. So there are two main ways which NF1 drives gastroparesis, and the first one is enteric neuropathy or nerve dysharmony. The NF1 genetic mutation can cause abnormal benign overgrowths within the gut's internal nerve network, specifically a condition called myentic plexus proliferation or neuronal intestinal dysplasia. Instead of smoothly coordinating the rhythmic this is very, very small that put this contractions needed to digest food, these disrupted nerves fire randomly or weakly, causing uncoordinated stomach contractions and severely delaying gastric emptying. Then obviously we go on to the next one, which many of us are aware of, which is internal tumours that cause blockages or pressure, which are the gastrointestinal stromal tumours or GISTs. And these are the tumours that develop in the upper digestive tract, which also can mimic or directly cause gastroparesis symptoms. So that's why it's very, very careful. You've got to make sure you got the proper diagnosis of one or the other, because sometimes you can have both, but sometimes gastroparesis can be mistaken for GISTs, and GISTs can be mistaken for gastroparesis. So many of us with NF1 complain of severe nausea, reflux and bloating, which is what I've had for over a year, and I still have it. I have it currently, and the nausea is really bad. The gastro reflux obviously goes up here and then it goes back down, and obviously I've got severe bloating as well, which doesn't help. Generic doctors do often dismiss it, which is what I've unfortunately been having. And the gut is full of nerves. We've got trillions of nerves in our body, and the gut has quite a lot, because there's a lot in the gut that has obviously our organs. And because NF1 impacts it, it also impacts gut issues, and they are unfortunately they are a legitimate part of the condition. So if you are worried, talk to your GP or NF specialist and do your best to advocate for yourself. I've done that with my local GP, and my mum obviously has written them a nice letter, because I'm still suffering now. So note that, I want you to note that imaging might always miss this. So something like a gastric emptying study might be needed, as it measures exactly how fast the food can leave the stomach, which is something I'm looking into, something I'm going to inquire about, because I still have a gut feeling I do have something within my gastro impact, even though I do have lesions in the brain on one top of my spine, and they do misfire, so I'm not getting the nerves into my gut. I still want something like that, just to make sure, and to take it off my shoulders, if you know what I mean. And there are various other things as well. So that's gastroparesis, and the next one is skin conditions. And people with neurofibromatosis, we have a higher likelihood of experiencing inflammatory skin conditions such as eczema, as well as several rare specialized skin disorders, which obviously makes our self-consciousness obviously quite low. So while conditions like eczema and psoriasis are common in the general population, recent clinical research has discovered that the genetic mutation that causes NF1 actively disrupts the body's immune system, which drives, that was my dog, shows that the genetic mutation that causes NF1 actively disrupts the body's immune system, driving a state of systematic inflammation. This makes the skin slightly more reactive. Large-scale global studies have found out that individuals with NF1 have a significantly higher rate of atomic multi-morbidity, which is a medical term for hyper-reactive immune system that systematically triggers certain symptoms of skin conditions, such as atopic dermatitis, which is eczema, which is a chronic dry itchy skin flares, which is what I have. I get really itchy, like itchy here. My eczema is mainly on my face, so I have to be careful of my face. Asthma and allergic rhinitis, which is a highly correlated respiratory condition that often fares alongside eczema. So I have asthma as well. I've got to have my inhaler on me at all times. I have 3. I have one in my bag, I have one downstairs, and I have one upstairs, just so I have one on me at all times. And the reason why this happens is because the loss of the NF1 gene doesn't just grow tumours, it actually changes how the immune cells talk to the skin cells. So this is the neuroimmune crosstalk. So obviously neuro, everything. It creates a pro-inflammatory microenvironment throughout the body, which makes the skin highly sensitive to external allergens and prone to the barriers breaking down. So which is why we are prone to asthma, we are prone to psoriasis, we are prone to rosacea, we are prone to hay fever, allergies. I have highly sensitive skin, so I have to be very careful what I am putting on my skin, even my hair, because when I've used something for so long, next time I use it, I end up having really bad itchy skin. And it's frustrating because I have to constantly change it, and then I have to change it again and again and again. So at this moment, I have found something that is working good for me, and it might not work for everybody else. So the hyperactive cellular signaling, which is the psoriasis connection, while a direct everyday link between NF1 and psoriasis is mathematically rarer, they do share a distinct molecular pathway. So they have overlapping pathways, such as a deficiency in the neurofibromin protein causes hyperactivation of the specific cellular pathways like the RAS, MAPK, and the hedgehog pathways. And obviously rapid skin growth is another factor within psoriasis as well. So with NF1, the pathway overdrives causes nerve and skin tissue to grow into neurofibromas. In psoriasis, these exact same hyperactive pathways drive the rapid, uninhibited multiplication of keratinocytosis, which is the surface of the skin cells, which results in thick, scaly psoriasis plaque. So this is why a lot of us feel like we have neurofibromas, but they're not neurofibromas. There is actually a form of psoriasis, which obviously makes us pulp out, if you know what I mean. So then you've got one that I think most of us are aware of, which is a high density of mast cells, which is known as the chronic itch, which is why they let us know if we're itchy, we've got to be careful. So one of the hallmarks of NF1 is an unusually high concentration of mast cells. Sorry, I know I paused that for a minute. I had to quickly go see something. So where was I? So one of the hallmarks of NF1 skin is the unusually high concentration of mast cells. These mast cells are the emergency first responders of the immune system, and they release histamine, which triggers inflammation when they sense danger, which is why antihistamines are usually our best friend. So within the NF1 gene, these mast cells gather heavily around the cutaneous neurofibromas and the capillary spots, and they are prone to misfiring. So they misfire signals, which releases massive amounts of histamine into the skin. This triggers a relentless deep bone itch called protiris that leads to scratching, which damages the skin barrier and worsens underlying eczema, psoriasis, and sometimes rosacea, because obviously rosacea is the butterfly effect. And then obviously you've also got different types of skin conditions on top of that. So you've got this, what's known as distinct comorbid skin conditions. And these are beyond eczema and psoriasis. A lot of clinical data which has been compiled by the Rare Disease Advisor has shown that people with NF1 are uniquely prone to specific lesser known dermatological comorbidities, such as cutaneous mastocytosis, which is an excess cluster of mast cells of the skin that form itchy red-brown spots. Then obviously in children you've got what's known as, I cannot pronounce, juvenile xenogrowth granuloma, JXG, which are benign yellowish skin nodules that commonly appear in children, little ones, with NF1. You also have the nevus anemicus, which is a pale patches of skin caused by localized sensitivity to adrenaline, which alterates blood flow to the area. Now, I do have these. I do have white skin patches, but mine are due to having an added on condition, which is from my great-great-grandfather, he was an albino. So I have albino patches on my stomach and my legs. Then obviously for treating for dry, itchy skin with people with NF1 requires looking at the whole picture, because we do have to be careful, because sometimes what works for one may not work for the other. So it isn't just dry skin that we have. It's a combination of overactive immune cells, which are the mast cells, firing under the skin, paired with the inflammatory skin barrier, such as eczema, on top. So that, because scratching the skin breaks the skin barrier, we are at risk of increasing the risk of painful skin infections around our neurofibromas, which is why we have to be very careful. Antihistamines, like I say, are our best friend. If we do feel itchy, antihistamines are good, and some types of cream are good as well, like steroid creams. So if you're all worried about skin conditions such as eczema, psoriasis, you can search for different creams and different similar to Vaseline, and obviously do a patch test. So to see which one is beneficial for you, I have one that I have upstairs, and it is made from 100% beeswax, and it's like honey, and it's absolutely brilliant. I'll try and post what I mean on my social media. So on my Instagram and my TikTok, I will show the little jar that I use, which I found has worked wonders for me. And it's lovely, it smells lovely as well. You only need a little bit of this. And finally, we go on to eye examinations, because eye examinations are also part of August Aware Month for conditions. So eye examinations are absolutely critical for people with NF1, particularly children as well, because the condition that we have can cause specific benign tumours to grow along the optic nerve, which we are all aware of. So for children with NF1, regular visits to the ophthalmologist are just not about checking for standard blurry vision or needing glasses. They are a life-saving screening tool to protect our eyesight, and obviously children's eyesight, and the neurological health of the eye. So the eye examinations are crucial for a number of reasons. The first being, we are at greater risk of developing optic pathway gliomas, and this is our primary concern. This is the one which is why they tell us to have annual eye checks. An OPG, optic pathway glioma, is a type of benign, slow-growing tumour, glioma, that develops along the optic nerve, which connects the eye and the brain. Now, OPGs occur in roughly 15 to 20% of children with NF1, and they almost always develop in early childhood, which is the higher risk period of having it there. So between the ages of 1 and 7, they very rarely develop after the age of 10, but they can still happen. And what is known as the silent danger, and it's because in their early stages, these gliomas, these tumours, are completely silent. Obviously, they don't know, and children cannot tell us if they have blurry vision, which is why I always say it's always best to talk to your children about their condition. A child will not feel them growing, and they do not cause pain, so they won't know if they're in pain, which is why you have to get your eyes checked. Because by the time a child noticeably complains about vision loss or starts bumping into walls, significant permanent nerve damage may have already occurred, which is why you should get them checked out. It's usually every year, but I think for children it's every 6 months, just do it as a precaution. So a specialised paediatric ophthalmologist looks for subtle early clinical indicators that a tumour might be pressing along the optic nerve. So things to look out for, obviously that they look out for, is optic nerve swelling, which is palpedema, or atrophy. And this is looking deep into the back of the eye, which can reveal the nerve if the nerve is under pressure or losing its healthy colour. Then obviously you've got vision changes on top of that. Children do rarely complain about vision loss or blurriness, especially in one eye, because the other eye does overcompensate. So when we lose vision in one eye, the other eye does that work for us, so we might not know. So specialised testing catches early drops in visual activity or colour vision. Even if you can't get to an ophthalmologist, there are some studies which you can do at home just to help. You have proptosis, which is what I have, and which is a bulging eye, which I don't have a tumour, which is an absolutely good thing. A tumour pushing forward from behind the eye can cause it to protrude slightly, but I have proptosis anyways, because as you can see, one eye is more protrude than the other. Then you have strabismus, which is cross eyes, which is the new alignment issues or involuntary eye drifting, can indicate nerve interference, especially if they've not been born with it, because some people are born with cross eyes, but sometimes it can develop as a child ages. And leaf nodules, this is for all across the board, this is for children and adults. So monitoring leaf nodules, the nodules are tiny, clear, yellowish brown bumps that grow on the iris, which is obviously the coloured part of our eye. Diagnostic tool which to see and monitor these leaf nodules are they are completely harmless and they do not affect vision. However, they are highly specific to people with NF1. And these matter because an eye specialist using a specialized microscope, which is called a slit lamp, can identify them easily. Finding these nodules helps doctors definitely diagnose NF1 in a young child who might otherwise only have a few flat NF1 birthmarks, like the NF1 caffeolase patches. So obviously I have them in my eyes, I have them obviously under my armpits, so the ophthalmologist always finds these nodules fascinating. So eye health is extremely important, and annual monitoring is needed so that we do not get anything nasty in our eyes. And they also help monitor our eyes as well. As you can see, I wear glasses, and this is because I have severe short-sightedness. So when I don't wear them, I cannot see. Everything is very, very blurry, and I have to squint. And I also have a form of astigmatism, which could also be anisostigmatism, which is more common in people with NF1. Now standard astigmatism isn't an NF1 side effect. It's not part of NF1. It's a completely different condition in itself. But unequal astigmatism, which is known as anisostigmatism, absolutely is, and it's something to be aware of because it is not harmful. It just needs monitoring, especially every year when you have your annual checks up just to monitor your eyes. So that is all I have found so far on everything. So monitor yourself if you can with these conditions. Stay sun safe. Monitor your gut health. Obviously eye checks as well, and skin conditions as well. Make sure your skin's safe. Now, I've not decided what I've done next month. I thinking I might do a Q&A. So if you are watching this and you're watching it to the end, please put your questions below. You can follow me on Instagram, which is Beth's Bumpy Journey. You can also follow me on TikTok as well, which is This Is Beth, or one word, This Is Beth. It's the same profile pictures as I have for my YouTube, so you can follow me there. And it doesn't have to be about NF1. You can ask me anything. It is more to get to know me, and depending on the questions I ask, if people want me to show something, I can. So like I can show you my favourite album, I can show you my dogs, I can show you stuff like that. So thank you for watching. But if I don't get any questions, I will think of something very, very quick, and I will post it when I can. And I know October, I've already decided October's going to be breast cancer, because October's breast cancer awareness month. And there's a few other things as well, I think in October that I'll be discussing. So please keep yourself safe in the sun, monitor your health, and thank you all for watching. Bye.